Hi, this is Dr. Girish AC, consultant plastic and cosmetic surgeon. I am heading Curls and Curves Cosmetic Surgery Center, Vijayanagar, Bengaluru. Rhinoplasty, also called as nose job. It is cosmetic surgery which corrects the nose shape and breathing issues. The shape variations can be too many. The nose can be thick, the nose can be long or short nose. So the nose can be wide. So or any crooked nose means the deviations, S-shaped deviations or C-shaped deviations. So all these deviations and also height of the bridge if it is less height or if it is a dorsal hump is there. So any deviations from normal or if it is not matching to their face. So for these situations, so we can do rhinoplasty. In cases of cleft lip, so they will have some nose deformities. Even with them also we can correct with the rhinoplasty. Some people will have breathing issues because of the nose deviations inside, that is called as deviated nasal septum, or it can be the turbinates, that is inferior turbinate hypertrophy can be there, or the passage is very narrow, some obstructions, pus. So any deviation which is causing the breathing issues can also be corrected by rhinoplasty. So usually we treat the septum and the shape, that is functional problem as well as the shape together. That is why it is also called as septorhinoplasty. Rhinoplasty is done as a daycare surgery under general anesthesia. So usually the morning admission happens, evening discharge will be there. So after that they can have the food normally. And we make a very small incision in the lower part of the columella, that is in the hidden part. And if we want to reduce the alar, the incision will be in the alar groove, that is alarfacial junction. Once again it is in the hidden area. So after this exposure, so we modified inside the nose, that is the cartilages, and the bone modifications will happen through various techniques. And also nowadays we make use of the technology, that is piezo osteotome, to do osteotomies. And finally our aim is to give them a normal shaped nose, so which can match to their face. And after the procedure we usually make use of splints. Externally we put external splint and internally we put internal splint, so that the swelling is under control and they can breathe through the nose. And there will be some plasters around the lower eyelid to control the swelling in the face also. So there can be some minimal bleeding which will be there for next one day, and after that it will stop. The pain will be very minimal, I can say, because majority would think so there will be pain because we do in the face and all. So definitely not. The pain will be very minimal and it will be controlled with the painkillers. With the discharge, so they will be very comfortable at home and they will stay for next 1 week at home because of the splints over the nose. After the surgery, so they can have normal food from same day evening. So there will be some minimal bleeding which stops after just a 1 day. So post that, if they have some breathing issues, they can come to us for some suctioning. If we do the suctioning, we can remove the clots that might be causing obstruction. After that, they can breathe normally for next 1 week. So there will be some splints over the nose. So these splint, that is called as external splint over the nose, and one splint inside the nose called as internal splint. So these splints are removed after 1 week. Immediately after the rhinoplasty surgery for next 1 week, they can have body bath, but regarding the face wash and head bath, that can happen only after 1 week. The pain will be very minimal, and it is also controlled with the painkillers. If they have a scope to do work from home, they can do that work from home job from next day also for next 1 week, and after that of course, and they'll be fit enough to do the offline works also. Otherwise they can resume their routine activities after having 1 week rest. Initially after the 1 week, the nose, it is slightly swollen, especially the tip and the whole nose. So the swelling will be to an extent of 4 to 5 millimeters. And we advise some tip massage to decrease or to settle the little swelling. Naturally, whatever the swelling is there, that is minimal swelling, 4 to 5 millimeters. So this reduces very gradually over a period. So at the end of 1 month, maybe around 50% of the swelling will be reduced. At the end of 3 months, 75% of the swelling, that is around 3 millimeter of 5 to 6 millimeter is reduced. At the end of 6 to 8 months, more or less the whole swelling is reduced and the final shape can be appreciated. Nevertheless, the nose looks better than before even after 1 week. and after that it continues to improve. If somebody is having some important event like maybe marriage, close relatives marriage or some event, so they should always consider the rhinoplasty at least 2 to 3 months prior to that very important event, because of some swelling, and the swelling reduces to a decent level by the end of 2 to 3 months. So they need not stay at home, they can go outside, but major physical activities like gym work can be started after 1.5 to 2 months. Otherwise, they can resume the normal walking, other things even after 2 weeks time. So there is no extraordinary or much care, but there will be a natural improvement in the nose which can happen over a period. The most important part of the rhinoplasty is the consultation part, because few people will send their photographs and they will ask the modifications and they try to discuss over the phone. But the ideal would be to have a consultation, because if they visit us, we get an opportunity to examine them and we can understand, because the photos are 2D, whatever they are, the photo sent, and the mobile photos are not as good as the seeing directly or taken from the DSLR cameras. So then after examination, we understand about their desire, what they want, what changes they want, and what bothers them more. So after this, so we take the photographs from a fixed distance, the light using DSLR camera. So then we make use of these photos. We take the photos in different angles. That is a front view, that is a side view, and that is called also profile view, and also basal view. So these three important views make us to discuss properly with them regarding all the changes. So then after taking these photos, we make use of 2D software to modify the images and we show them. So then this can be a very good feedback from them. We can have a good feedback regarding this. After the whatever we show, if they want any further modifications, further slight changes, so we can understand what exactly they are looking for, and accordingly we can discuss about the procedural details, how we do it and how we are going to achieve. Can we achieve 100%, 90% of it, whatever they are expecting. And also this will give us an opportunity to discuss about the suitability of the changes what we make after the procedure. So the consultation is considered as very important part of the rhinoplasty surgery. After that, if we require, if we feel, because some people will be having some nose obstruction, breathing issues, and if we feel that they will require some CT scan of the nose, that is called CT scan PNS, so we advise it. So the consultation is very important part of rhinoplasty.